Hello from sunny Brighton in the UK. Weather outside is currently dark. My name's Ian Williams. I'm really sorry I couldn't be with you live today for this panel. I'm a comics artist and doctor, and I am the author of The Bad Doctor graphic novel and the follow-up The Lady Doctor, and I'm currently working on third novel to complete the trilogy, provisionally entitled The Sick Doctor, and that should be out next year. I'm also one of the co-authors of the Graphic Medicine Manifesto. So I defined the term graphic medicine, and I said that graphic medicine was the interface between the medium of comics and the discourse of healthcare. So the COVID pandemic has been very strange. I'm a family doctor. I work in a health centre, and over here the immediate response of family doctors to the pandemic really was to shut the doors and stop seeing people face to face. So initially the biggest change was A, that I was doing everything over the phone, and B, my standard of dress rapidly went down. I no longer had to dress smartly to see people, and this is what I look like at the moment when I'm talking to people over the phone. I look like I could be hosting a call-in chat show on a local radio station. We have latterly started seeing patients again face to face. We're now actually seeing people who've probably got COVID. Initially, all those people were seen in what was called a hot hub locally. So I did a weekly comic strip in the Guardian newspaper, which ran for a couple of years. And in that, I had to come up very quickly with comics responses to things that were in the news, to news stories. And I did a 4-page strip, and one a week. It was incredibly hard work. It was incredibly hard to come up with something really rapidly. But when the pandemic hit, I thought, well, I should be able to respond to this really quickly. However, I found actually that it was incredibly difficult. For one thing, my medical world was reduced to the inside of my consulting room. So the only thing I could really contribute to the iconography of COVID, if you like, was me sitting in front of my computer talking to patients. And also the news changed day to day. Every day there was something different about COVID on the news. So I started to do a couple of strips, which was basically me on the phone. So here's one. So it feels like you're not too bad considering. No, I'm okay, keeping myself away from this bug. Anyway, how are you, Doc? I'm so grateful to the people in the front line. You're doing such a great job. Must be crazy down the surgery. Well, it's the folks in the hospital that I feel for. We're flat out here, but trying to deal with most things over the phone. We're not really seeing many patients face to face, but all that might change as things evolve. Listen, shall I book you in for a follow-up to call in a month? Oh, yes, please. If we're both still around. Hey. Then things started to change. Things got more serious, and a real change seemed to happen when Boris Johnson, the Prime Minister, went down with COVID. Now, Boris Johnson is a very controversial figure in many ways. He shares some of the characteristics of your former president. He's a similar popularist. He has a very loose idea of what is the truth, and he'll basically do anything for power. I dislike him as a person and as a leader, but when he went down with COVID, I sort of actually felt, and I think many people felt the same, felt quite sorry for him. And it suddenly brought home the reality of the pandemic. So here's a strip I did about that. And tonight, the Prime Minister is in intensive care at St Thomas's Hospital. Fuck! Boris is in ITU. Bloody hell. This seems symbolic. Hopefully everyone will take this seriously now. The doctor's WhatsApp group is going nuts. More serious than they say. Is he on a ventilator? Having CPAP? Everyone's speculating about his condition. Ding! He's only a year older than me. He's not as fit as you. Men over 50 seem to be at increased risk. Bonnie's dad is a doctor in Texas, and they're not letting medics over 50 see patients face to face. My Joe Hero days are over. I want to see my son grow up. So, I mean, Boris Johnson is similar age to me, and it looked for a while like he was going to be ventilated. He was sort of quite seriously ill. Anyway, we all thought that after coming out, he'd be a changed character. His kind of humanity lasted for about a week, and then he sort of went back to his old self. But here's another strip that I did, and this one was about, like, based on a patient who had an odd reaction really to the pandemic. Hello, Mrs. Doctor, is that you? Is that you, Doctor? Have you got the results of my hip scan? Only I'm in pain. I'm in pain all the time. Well, as I told you, the result will go back to the orthopaedic surgeons, not me. Only I keep ringing them at the hospital, but they don't answer. They don't answer. Well, maybe, I guess they're a bit busy at the mo, Well, I thought if you could ring them, you could tell them that they need to get on with my operation, because if they could do it in the next few weeks, I'm sorry, that's just not going to happen. With a couple of comorbidities, this lady should be shielding, but trapped in her world of medical dependency, she cannot help but demand action. Well, if you could just ring them. Look, I did ring them, I told you. They didn't have the report. Well, if you can ring them again. We're in a pandemic. I'm not going to hassle them. So you won't help me then? What am I supposed to do? Same as you've been doing for years. You stay home, you keep safe, you take your OxyContin, your gabapentin, your amitriptyline, your diazepam. But I'm in pain and no one's doing anything. Well, maybe it's better to be in pain, at home, safe than... What? Nothing. So, I put this... This strip was meant to show my frustration with a very demanding patient who seemed completely oblivious to the news and oblivious to the fact that there was a pandemic on and the hospitals were rammed with patients with acute COVID, and all she could talk about was her own problems. I did this strip and I put it out there, and remarkably, people took it very differently. Obviously, I wasn't reading it out, but people took it as my regret that I couldn't do anything for this patient, and that sort of I was feeling terrible, and people said, "Oh God, that's really heavy." And actually, it was just meant to show my mild irritation with this lady. Anyway, she still hasn't had her hip operation. So the number of doctors and healthcare professionals in the UK who draw cartoons is relatively small, obviously, but they are out there, including my friend Muna Al-Jawad, who operates under the name of Old Person Whisperer. Muna is a care of the elderly consultant, and I spoke to her about making comics in the time of COVID, because online there were lots of COVID diaries out there, people doing comics, but these were mostly by people who were shielding or at home, not healthcare workers. I did a few more strips than I've shown you, but I didn't feel particularly productive. Anyway, Muna felt unable to produce anything until the pandemic had died down. And I asked Muna about this, and she said, I couldn't draw comics during the peak of the COVID outbreak. I was working in the emergency department and the acute medical unit mostly. It was a difficult time, and it felt as if the threat to my personal health and that of my family plus my colleagues were getting ill, and there was a lot of emotion around older people potentially dying from COVID-19 and fighting it against the just leave them all to die arguments that came to me from some quarters. I think it takes a while for me to work out what I'm feeling, and I need distance and time to understand it. Another thing was that comics are stories, and the story of COVID-19 kept changing so fast. So what might have being reasonable one week seemed ridiculous the next, and vice versa. So here's a story that Muna made after the main peak of the pandemic. And this, she called this claptrap, and this was about the habit of clapping for the NHS. So just to explain what happened in the first lockdown was that on a Thursday night at 6 p.m, everybody in Britain was supposed to go out on their front doorstep and clap and bang pans and things like this. And this would sort of be meant to rally and encourage NHS workers who were going into the fray and exposing themselves to COVID. Claptrap. Rainbow stolen from the gays. Old person whisperer rages from behind the mask and plastic apron and gloves. In January 2020, I took up running. Couch to 5k. 43 years old. About time I had my midlife crisis. End of February, I saw my first patient with COVID. It's like a viral pneumonia. He's hypoxic, but looks well. Did you ask about travel or contacts? I didn't want to in case he said yes. Can we get a test for it? I kept running into March. This COVID thing is going to be a big deal. Gulp. COVID case numbers. This was last March, obviously. Our rotas changed. The hospital changed. We were prepared for the worst. And one night in March I heard clapping. Well, it wasn't that good a time, but thanks anyway. Oh, this is the NHS thank you clap. Scared but brave, ready for what horrors would come. Clapping, clapping, it's for us. I admit I was moved. But then I thought, thanks for what? Being heroes, being martyrs, doing our jobs, being part of a system, allowing people to die, and I felt uneasy. By the fourth week of clapping, I'd had enough. John, another doctor, just walking past. Oh, hi. Hiding at the end of my road. It makes me feel sick, John. Oh, okay, see you later. The thing is, they mean well, but this is not a battle. I'm not a soldier. I expect our employees to keep us safe at work. I can't work out if the powers that be are incompetent or don't care, but this claptrap is now part of their fucking narrative. Yeah, clapping. Woohoo! The weeks went on. Structural inequalities played out in death rates and PPE rules. Still only these masks. Oh, visors too. We just got on with it. Quietly fuming, getting on with it. Zoom department meeting. Had COVID, getting on with it. Reading all the COVID literature, getting on with it. Well, at least they've stopped clapping. The med school was reminded that Black Lives Matter. Can I help decolonize the curriculum? And I remembered that I worked at the med school. Now it's September, I'm still running. Gulp, COVID case numbers. So, Muna's talking about the idea of the health worker as hero, which was sort of proposed by the government, and the same government that was sending people to work without really protecting them. We didn't have adequate PPE. People in the front line in hospitals, in ITU, didn't have adequate PPE. When the immunisations were rolled out, they were fairly slow to immunise healthcare workers. There were lots of people, especially from BAME backgrounds, who remained unimmunised, and GPs. They closed down the hot hubs. We were expected to see COVID patients, but they wouldn't let us be immunised against COVID, even though we were going into nursing homes and things like that. So there was a lot of disgruntlement around the handling of COVID in this country, and that remains. I'm going to leave it there. Thank you for listening. Find me on Instagram @TheBadDoctor. Please have a look at the Graphic Medicine website.